Spike in sickness in the metro. Things are so bad tonight. You could spend almost as much time in the waiting room as you do as a normal day at work. The culprit, flu cases rising, and the COVID numbers are starting to tick up again. Area hospitals tell News 4 wait times for the emergency room visits are on average about 6 hours right now. News 4's Gabriela Vidal looking into that tonight, as well as troubles for the region's urgent cares. Gabby.
Sam and Corey, just looking online at the Total Access Urgent Care site, at least 8 sites in the St. Louis metro region were fully booked today, and as many as 10 to 13 patients were in line at multiple other locations. And with the holiday almost here, medical staff in the region are bracing for more patients.
Flu, COVID, and RSV.
We're seeing about a 39% positivity rate on the patients that we test for influenza. We're seeing about a 14% positivity rate in the patients that we test for COVID.
Now, these respiratory illnesses combined are causing a different kind of headache. News 4 was inside the Total Access Urgent Care in Florissant, as patients were told wait times for service could be several hours long.
It is not uncommon to wait for 1 to 2 hours, sometimes more. It depends on what time of day it is.
Mike Jelinek is a physician assistant at Total Access Urgent Care, where he says they're seeing more cases of the flu than last year, combined with an existing shortage in healthcare workers.
We're doing the best we can to see as many patients as we possibly can with the staffing that we do have.
But the wait.
In the last couple of weeks, we've seen people die from COVID and from influenza, and more from influenza than COVID recently.
Is reaching even higher numbers at area hospitals like Barnes Jewish.
So on average, if you're coming in and you can be discharged from the emergency department, you're going to wait 6 hours or more often. And that's to go through everything, the waiting time and to get treated and to be discharged. If you're being admitted, we're seeing anywhere from 9 to 12 hours on average stay.
Dr. Robert Poyer says their emergency department is prioritizing the most critically ill or injured first.
Now, some people get sicker during the several-hour wait to be seen, and so your priority in the line may change.
Now, if you can treat your respiratory illness at home, you're asked to do so. And if hospitals say if you do have major complications, then seek medical help as early as possible in the day so you can get treated first. Gabriela Vidal, News 4.
Gabby, thank you. New at 6, we are